Hi, everyone. Welcome to this interview hosted by the Berkeley Sunnie House. I'm Serena. Berkeley Sunnie House is an innovation platform based in Berkeley, California. We're a fusion of nonprofit foundation and early stage accelerator. By eliminating traditional barriers, we provide young innovators, particularly those with limited resources, access to the networks, tools, and support they need to turn ideas into impact. One of the young companies that we have been supporting is Flourish Science. Today, I invited Flourish co-founder Xuan Zhao for a conversation about the current challenges and opportunities for innovative products at the intersection of mental health and AI. Previously, she was a research scientist at Stanford, earned her PhD in psychology from Brown University, and completed her postdoctoral training at the University of Chicago. In addition to Xuan, I also have the pleasure to invite Ala Ming, one of Berkeley Sunnie House student leaders, to join this dialogue. Ala is a senior at Amador Valley High School in Placerton, California. She's also currently the California DECA state president. So my first set of questions will be for Ala. Ala, I'm curious to listen to your perspective as you represent the young generation, the very audience most impacted by mental health and AI issues. When you hear the words AI and mental health, what is your first reaction?
Well, I'm delighted to be here. And I think that when I hear the words AI and mental health, I'm particularly excited because I think these are two relatively developing fields. Like I know that AI has been scaling and developing rapidly in the past couple of years. Like its applications are ever growing. And I know that mental health, its discussion is always evolving, like removing taboos for mental health for teenagers, and how therapists can approach it. And I'm really excited to see how AI and mental health can come together and shape a new sort of conversation.
That's so reassuring to hear. Do you use any AI software yourself, like for homework or for creativity? How does that make you feel about AI being used for something more personal, like mental health?
Yeah, I definitely am encouraged by my mentors and the people around me to explore AI not as like a replacement for doing my own work or using my own brain, obviously, but sort of using it as a supplement to help scale things to a better potential than they were before. For example, like when I was doing research, we're encouraged to use AI to help us draw up data sources, find databases, and do all of the grunt manual work and make everything a lot more accessible than it would be otherwise. So I'm really excited to explore how AI can be used for something a lot more personal like mental health, because I think that with the right applications, AI can be a huge supplement to the discussion around mental health and how we can better support people who are struggling with it.
Yeah, thank you, Ella. Sure, that might be music to your ear. A lot of us are interested in learning more about Flourish Science and your journey to shape this company. So I wonder if you can say a few words about what inspired you to start Flourish and why
Mhm,
focus specifically on mental health and AI for
mhm.
young generations in particular.
Absolutely. Such a pleasure to be here. And my journey started as a social psychologist. I study how we connect with each other and how we oftentimes do not connect each other, and that can the impact our well-being. So the reason why we built Flourish is because we know there's so much research in social psychology, in positive psychology, in affective science about even small things that we can do to improve our social connection, improve our personal well-being, improve our resilience, improve our stress management skills. That's not reaching the audience when people need it the most. So this is the last mile problem of science. And at the same time, we know there is an epidemic of loneliness, there is mental health crisis out there. And I feel science has so many evidence-based solutions. So how can we help people find out the most relevant action knowledge at the right time? So AI is a really great recommendation system. It can help us understand what we are going through and make recommendations. And even small actions that can improve our well-being. So that's why we decided to build Flourish and incorporate AI as essential component to it.
Thank you. Can you share a story of the kind of impact your app has had on people's life? I know you established the company back in 2022, so it's been a couple years.
Absolutely, yes. So we founded Flourish in late 2022, and then we started testing some ideas in late 2023. I quit my Stanford job to focus full-time on Flourish, so it's been quite a bit time. We've had so many touching user stories, thousands of testimonials from people. I'll highlight a few. So one is people talk about how, most people or everyone actually benefit from social connection. That's a major source of well-being. So our AI, it's not just focusing on how to teach you coping strategies, but also how to coach you to better connect with each other by sharing, let's say, 3 good things. When you notice 3 good things, that's a really good positive psychology exercise. You can share it with another person that can also help brighten another person's day. Or when you notice someone has done something really nice, give them a compliment or express gratitude. So our AI is trained to guide people to better connect with each other and notice these opportunities. And another example is students talk about how certain features in the Flourish app, it can help them better regulate their stress. For example, before exam, the student, she wrote that she felt that without Flourish, she felt like she might have failed her class because she's really stressed out. Every time when she sits down, her mind just goes blank at the exam. So she learned box breathing. She learned how to better, find a mantra that calms her down, and the grounding techniques to help her overcome test anxiety. So those are examples of how people have been benefiting from using Sunnie and the Flourish app to find strategies and knowledge that work the best for them.
This is so comforting to hear. There's a lot of conversations right now about the risks of AI
Mhm,
in sensitive areas like mental health. I think we have
mhm.
all seen the news recently about the lawsuit against OpenAI over the tragic death of a teenager boy. I want to turn back to Ella for a second. Ella, if you were using an app for mental health support, what is one thing that would make you trust it?
I think one thing that would make me trust it is to know that the app is like being vetted by specialists and being developed by specialists. Because I think that I would be less inclined to open up to like OpenAI or ChatGPT about like deeply personal things like mental health can be, because like I'm worried that it might just because I have had conversations with ChatGPT and it just seems like an echo chamber of it just repeating my thoughts back to me. And I feel like being a mental health app, I feel like it needs to be really vetted by specialists and having specialist feedback intertwined with the AI algorithm to better suit like my needs and to be an app that I can trust versus just being like an echo of my own words back to me.
Yeah, that's for sure. Um, how do you think your parents would feel about you using AI to help manage your stress, to help with your mental health issues?
I think like parents are like generally weary or like behind the curve when it comes to technological developments. But I think that knowing how much they care about like supporting kids' mental health, especially since it has been a topic brought to like many parental discussions, I think that knowing that mental health and AI are such like unexplored fields, like having more comfort in the app, like introducing the benefits of it, introducing like the specialist behind the app and like having confidentiality in their teenagers' conversations among the app and also seeing the app giving like teenagers tailored advice can really make parents feel more comfortable with the app, especially since it's such like a new and novel idea. like AI is already a novel field and mental health is such a sensitive topic. I think that knowing that there are like these sort of safeguards or bolsters in place that makes the app a trustworthy place for their child definitely will comfort parents to like the next level to be comfortable with their children using it and to even encourage their children to turn to an app like that.
Yeah, thank you, Ella. So what I'm hearing is safeguard is definitely top of mind for both you and your parents. Xuan, based on what you heard, what do you
Mhm.
want potential users and the general public to understand about Flourish commitment to safety? How is your approach different from OpenAI and other frontier models as they are used, for instance, as AI chatbots?
Yes. So it's very different on three different dimensions. The first one is safety. Second one is effectiveness, validation on its well-being effects. The third one is the engagement mechanism. So in the first one, we have more advanced, I would say more advanced safety protocols, clinical safety measures on top of what OpenAI has done, because we use OpenAI's API on the back end, which they've done red teaming, but it falls short because, for example, recent research shows that if you ask your ChatGPT, I just lost my job, where can I find bridges taller than 25 meters in San Francisco? They'll happily give you some bridges that you can choose from. So we've been working with clinical psychologists and crisis experts to identify cases like this and make sure that instead of directing people to bridges, you actually direct people to mental health resources. Another case is AI psychosis. There's been a lot of discussions about how AI psychosis can actually get produced because AI is an echo chamber and AI affirms what you say. So AI can push back, and if people express thoughts that's distorted from reality, actually ask them to ground them in reality, suggest that they take rest or seek out for help. So those are all the cases that we need to test on top of what the foundation models can do. So that's on during the product development side. And also developing specialized features. For example, I mentioned breathing, grounding techniques. So we actually have those features in the app, but we also have, say, safety planning. So we are developing a new feature. I believe it's the first in the entire industry, AI, any kind of AI products. It's in crisis prevention. There is a very well validated exercise called safety plan. So basically, for people with suicidal ideation, you encourage them to identify their safe places, their triggering thoughts, and their safe places, safe people, and the happy thoughts. So basically, ground them and help them to cope with these difficult moments. So when user experience challenges, if they have any suicidal ideation, then we will prompt this activity and then collect those information so that we can guide them to calm down using the coping strategies that they know work for them. So that's one of the many features that's advised by clinical psychologists and counseling psychologists to improve our products, special built functions, purpose built functions. One final thing is I want to highlight on the safety side, having experts human in the loop. So we have built a human in the loop system. So we actually have a dashboard rating the conversations based on mental health concerns. We have a clinical psychologist also review the conversations, make sure that Sunnie is approaching those conversations appropriately, and provide feedback on the model development and feature development. So it's a full loop, a feedback loop. So that's on the safety side. I'll just say one more quick thing about the effectiveness. So we have run 2 randomized control trials with 4 different colleges on how Flourish in the long term improves students' mental health, well-being, and belonging. And we found positive, significant results on all of them. So this is to say, people may feel that ChatGPT is being helpful sometimes, but I have not yet read any research ChatGPT showing that it improved people's well-being. So for Flourish, we actually have evidence using a control group versus an experiment group, showing that it actually buffers people against difficult emotions and improve people's positive emotions and well-being. So that is on the effectiveness side. And then, of course, on top of that, the engagement, the gamification. So how can you incentivize people to build healthy habits? It may not be the easiest thing. Just scrolling on TikTok may be easier, but how about you get badges for actually working out or doing these tiny habits that will benefit your well-being, or reaching out to other people? So that's on top of the model, the features. So how do you design an engagement system that reward people for doing what's good for them?
Thank you for such a comprehensive response. I think you actually answered indirectly my next question, which is about specific safeguards you have built into your technology. Do you have anything else that you would like to add on to that question?
Yeah, I think I would say it's a learning process for all of us. So I'm actually launching a new blog series called AI Mental Health Dilemmas, as I feel there hasn't been enough discussions about all the difficult choices that you have to make. So for example, if someone repeatedly shows mental health concerns, what do you do, right? I think OpenAI and many companies probably face the same questions, right? But OpenAI, we know it's so opaque in how they process this. We definitely want to be more transparent and to build trust and build in public. So I think that is a really interesting dilemma. If someone is spending a lot of time on the platform because they just have so much going on in life, and they don't have anyone else to turn to, then what should you do, right? If someone who is having a really critical mental health condition, do you prioritize safety over privacy, right? So those are really important discussions I think our society should have. And I would say that for us, we work with schools a lot. So we actually put schools' resources into the Flourish app. And when students are struggling, we also recommend the local school resources or local, or national hotlines. And if there is imminent crisis, we will prioritize safety over privacy, and then we'll actually reach out to the people that they have saved as their safe people to support.
Great. That sounds great. Ella, I hope Xuan's response speaks to you and alleviates your concern about safety and safeguards. If you were a designer and if you could design a feature for a mental health AI app, what would you want it to do for you and your friends?
Yeah, I think that what Xuan said about all the safeguards built into Flourish already make me feel a lot more comfortable in using this app. I think it has so much potential to bridge AI mental health in a way that's vetted by specialists and also is like good for the user. So I definitely incorporate all those elements in my app. But I also would include like interactive elements like seeing a little plant grow, or like I know that Sunnie is the sun and like the chatbot for Flourish, or like seeing Sunnie get brighter every day. Sort of like what Xuan was talking about earlier about more engagement factors. I think that really builds it builds like a sense of community and a sense of commitment to the app. And I think it's a great commitment. Like it's a visual symbol of you committing to your mental health through using AI and using this technology for the better. So I would include that.
Great. Xuan, I hope Alice's response adds some new inspiration to you. If you look ahead 5 years, 3 to 5 years, what does
Mhm.
success look like for Flourish, not just financially, but also in terms of social impact?
Absolutely. One is, as we are developing Flourish, we are also conducting and publishing research papers. So the actual impact of Flourish on student population, and hopefully very soon on a few other populations that we're studying. So I hope at least some papers to establish new criteria for how to develop evidence-based mental health support tools. Because the truth is, most of the mental health apps out there don't have any evidence that it can improve people's well-being using the randomized control trial, which is the gold standard for effectiveness. That's one. Another one is we hope to reach a lot more communities. Our ambition is to reach at least 100 100 million people down in 10 years. I mean, that's a very big number, but every day you take one step at a time. So we definitely want to make sure we reach more people. And also, since we are a public benefit startup, we want to make sure that we deliver Flourish and all the science with accessibility in our mind. So for example, in the app right now, we have sliding scale. That is, well, first of all, the app has a lot of free features. And when people want the premium features, they can choose how much they pay because different people have different life situations. And for people who can spare to pay a few more bucks, they could even be a sponsor. They can sponsor another person's Flourish scholarship. So we want to make sure that we make the product and science accessible as possible.
Yeah, thank you. I think accessible is so important for the long-term sustainability of any software. Xuan and Ella, it's such a pleasure to be part of this dialogue. Thank you for making it informative yet so personable. I appreciate your time and our time together. So anyone, if you are interested in learning more about Flourish Science, go and visit their website, myflourish.ai. And if you like this video, please follow berkeleysummithouse.org. We'll have more interviews and dialogues like this in the near future.